Have you noticed your loved ones seeing people who aren't there, experiencing confusion that comes and goes like a light switch, or developing tremors that appeared seemingly overnight? These could be the early warning signs of Lewy body dementia, a condition affecting over 1 million Americans that's often misdiagnosed for months or even years. I'm here to share what I've learned through several years as a home caregiver, combined with extensive personal research to help you understand this complex condition. My practical experience caring for a family member with dementia has taught me invaluable lessons that I believe can help your family too. Today, we're diving deep into Lewy body dementia, exploring the specific warning signs that distinguish it from Alzheimer's, the diagnostic process you can expect, proven treatment strategies that actually work, and most importantly, practical ways to support your loved one and your entire family through this journey. By the end of this video, you'll understand the 3 critical signs that demand immediate medical attention, know exactly what questions to ask doctors, and have a roadmap for creating the best possible quality of life. Let me emphasize, everything we discuss today should complement, never replace professional medical advice. Please consult with qualified healthcare providers for proper diagnosis and treatment. Let's start by understanding exactly what happens inside the brain when someone develops Lewy body dementia, because this knowledge will help everything else make perfect sense. Picture tiny protein clumps called Lewy bodies slowly accumulating inside brain cells, like rust building up in delicate machinery. These abnormal deposits contain alpha-synuclein protein that disrupt normal brain function. What makes this condition particularly challenging is that these proteins don't just affect one brain area, they spread throughout multiple regions simultaneously. This widespread distribution explains why DLB symptoms are so varied and unpredictable. Research shows that the same person can seem completely normal at breakfast, then confused and disoriented by lunch, only to return to clarity by dinner time. DLB represents approximately 10 to 15% of all dementia cases, making it the second most common type after Alzheimer's disease. Yet research shows families wait an average of 18 months for accurate diagnosis. Precious time that could be spent getting proper treatment. Here's the crucial difference. While Alzheimer's typically begins with memory problems that gradually worsen, DLB presents fluctuating cognitive symptoms. Think of trying to tune a radio with poor reception, sometimes crystal clear, other times full of static. Your loved one might have a completely normal morning, handling complex conversations and daily tasks. That same afternoon, they're confused and disoriented. By evening, they return to baseline, leaving everyone wondering what happened. This unpredictability isn't rapid progression. It's actually a diagnostic feature that helps doctors identify DLB. Understanding this pattern can help families respond more appropriately during difficult moments. There are 3 hallmark symptoms that distinguish DLB from other conditions. Recognizing these early can completely change the trajectory of care. The first major warning sign involves dramatic cognitive fluctuations that go far beyond normal good and bad days. We're talking about striking changes in alertness and thinking ability that shift within hours. Research shows this occurs in approximately 80% of people with DLB. Consider this common scenario. A person with DLB might discuss vacation plans in detail in the morning, read the newspaper, and seem completely normal. By afternoon, they don't recognize their own home and ask when their mother is coming, despite her passing years earlier. By evening, they're back to normal, wondering why everyone seems worried. The second core symptom involves detailed, well-formed visual hallucinations. About 75% of people with DLB experience these, typically seeing people, children, or animals that appear completely real. What's important to understand is these aren't usually frightening experiences. People describe them matter-of-factly, saying things like, "There's a woman in a blue dress by the kitchen table," or "Those children are playing too loudly in the living room." The hallucinations often involve familiar figures and seem harmless to the person experiencing them. The third hallmark involves movement problems mirroring Parkinson's disease. Muscle stiffness, slower movements, balance difficulties, and sometimes tremors. These physical symptoms often appear early and may be the first changes families notice. What's crucial to understand is that these aren't signs of normal aging. They're specific medical symptoms requiring immediate professional evaluation. The diagnostic process requires careful medical detective work because there's no single test for DLB. Here's what families can expect when seeking proper medical evaluation. Comprehensive evaluation begins with detailed questions about symptom timing and progression. Doctors want specific information about sleep patterns, especially if your loved one acts out dreams, physically called REM sleep behavior disorder, which affects 80% of DLB patients. Cognitive testing focuses on attention, problem solving, and visual spatial skills rather than just memory. Someone with DLB might struggle copying shapes or following instructions while remembering recent events fine. Brain imaging plays a critical role. A DAT scan measures dopamine activity in specific regions. DLB typically shows reduced dopamine function, distinguishing it from Alzheimer's with 85% accuracy. Here's something absolutely vital to understand. People with DLB can have dangerous reactions to certain antipsychotic medications commonly prescribed for other conditions. Correct diagnosis prevents potentially harmful treatments. Finding neurologists specializing in movement disorders or dementia care makes an enormous difference. Don't hesitate to seek second opinions if initial evaluations seem incomplete. If this information is helping you understand what your family might be facing, please take a moment to subscribe to our channel and give this video a thumbs up. Your engagement helps us reach more families who desperately need this information. We regularly share practical caregiving insights based on real experience, and I'd love to have you as part of our caring community. While there's no cure for DLB, proven treatments can significantly improve symptoms and maintain quality of life longer than many families realize. Medication management requires careful, individualized approaches. Cholinesterase inhibitors, originally developed for Alzheimer's, often work remarkably well for DLB. These improve cognitive function and, surprisingly, often reduce hallucinations. Clinical trials show meaningful improvement in 60% of patients. For movement symptoms, some people benefit from low-dose levodopa, though only about 50% of DLB patients respond positively. Starting with small doses and monitoring carefully is essential. Sleep management often provides immediate family relief. Melatonin treats REM sleep behavior disorder, reducing injury risk. Consistent routines and bedroom safety are equally important. Environmental modifications can be as powerful as medications. Better lighting dramatically reduces hallucinations. Many families are amazed by this simple change's effectiveness. Predictable daily routines help manage cognitive fluctuations. Physical therapy focusing on balance training and fall prevention makes huge differences. Research shows regular exercise slows movement symptom progression while improving overall well-being. Nutrition support becomes important as swallowing difficulties can develop over time. Working with speech therapists early prevents complications. The key is working with healthcare teams experienced in DLB who understand the delicate balance needed between different treatments. Always consult with qualified medical professionals for personalized treatment plans. DLB affects every family member profoundly. The unpredictable nature creates unique challenges different from other dementias. Research shows DLB caregivers experience higher stress than Alzheimer's caregivers, primarily due to unpredictability. Certain strategies genuinely help families cope effectively. First, learn to identify fluctuation patterns. Many families discover that fatigue, time of day, and environmental factors influence cognitive clarity. Simple daily logs help identify triggers and plan accordingly. When hallucinations occur, respond to emotions rather than arguing reality. If someone sees children playing, try responding with "Tell me about these children. Do they seem happy?" This validates their experience while maintaining connection. Building support networks early makes enormous differences. Organizations like the Lewy Body Dementia Association connect families facing similar challenges. These relationships provide practical advice and emotional support you can't find elsewhere. Don't neglect caregiver health. DLB caregiving is demanding and unpredictable. Regular respite care and maintaining social connections aren't luxuries. They're necessities for sustainable care. Having organized resources and emergency contacts readily available can help tremendously during difficult moments. That's why I've created a free resource guide specifically for dementia families. Dementia presents real challenges, but doesn't end meaningful time with your loved one. With proper diagnosis, appropriate treatment, and strong family support, many people maintain good quality of life for years. The most important takeaway: early recognition and medical care make enormous differences. If you recognize these warning signs, seek evaluation from experienced neurologists immediately. Remember those 3 key symptoms: cognitive fluctuations, visual hallucinations, and movement problems. These aren't normal aging signs, they're medical clues requiring professional attention. Before you go, I want to offer you my free Dementia Care Resource Guide. It includes a contact list template, essential websites and phone numbers, plus room-by-room home safety modifications. You'll find the download link in the video description and pinned in the comments below. If you found this information valuable, please share it with others who might need these answers. Consider checking out my book, Navigating Dementia Together by L.E. Summers, available on Amazon, where I share detailed strategies from years of hands-on caregiving experience. Subscribe for more practical caregiving content based on real experience, and remember, you're not alone in this journey. There are effective treatments, supportive communities, and genuine reasons for hope. Most importantly, always consult with qualified healthcare providers for the best medical guidance. While I share what I've learned through experience and research, professional medical advice is irreplaceable for your specific situation. Thank you for watching, and be sure to click on the links for the free information that can make your journey a smoother one. Click like, subscribe, and share to help others in the same situations. Your efforts to learn and share your experiences are a true act of love.